Good afternoon, everyone, and welcome to A Gathering Place and welcome to 2023. Happy New Year. I know it's a little bit late in the month, but I actually took some time off to get some rest mentally and physically. So it is very appropriate that in the month of January, when we're all recovering from the holidays and maybe taking a vacation, that we're kicking off the new year 2023 with public health awareness. And we have Dr. Natasha Colvin Newman, who's going to talk about what's going on with COVID-19, vaccines, and just probably some general stuff with pharmaceuticals, because she is the pharmacist at St. James Health and Wellness. And hopefully we'll also be joined by Miss Linda Lynah, Community Relations Liaison. So we're going to be right back after this opening.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question. Well, we're back, folks, and I am excited to share Miss, well, I should say Miss Dr. Natasha Colvin Newman with you and hear her information, right? So let's go ahead and get started and bring her in. Good afternoon.
Good afternoon.
How are you doing?
Good. Thank you for having me again. It's always a pleasure to join you and provide my little bit of expertise.
Hey, it means a lot, and we're delighted to have you here. And I just want to remind everyone that Dr. Newman is here and she can answer your questions after her presentation. But, so get those questions ready and everything, because we have some updates in health. And from St. James Health and Wellness, she is a great representative, and she's got some information for us. So why don't we get started? Let's go to the next slide. Here we go. COVID-19 vaccine, shingles, and cap on insulin costs. Wow, I'm looking forward to hearing this. So what's going on with COVID-19 and vaccines?
Right. So I think the last time I was actually on here was in July of last year. So, quite a bit has changed since then. So I think last time we were just getting into the Omicron variant, the COVID variant, all these different Delta, Omicron, all these letters are coming out now. So as of right now, we're at a subvariant of the Omicron variant, and it's XBB.1.5, and it currently, takes up about 43% of the current cases nationwide, and that's followed by BQ.1.1, which is 29%. And again, both of these are subvariants of the Omicron. And as noted by the CDC, that the Omicron is more transmissible as compared to the Delta, which was like the first variant that was put out. So it's easily spread. So although a lot of the, precautionary measures have been lax, I do still like to encourage, that we all do our part in trying to prevent, more variants coming out and slowing the spread, because the more we stray away from these precautions, the more subvariants we're going to have, and the more harder it's going to be to keep a cap on trying to get this rid of. But at this point, it was called COVID-19, and now we're in 2023. So we're going on 4 years of this, which seems like a very long time, but it has seriously flown by. So again, I know I've mentioned this in the past, so what can we do and what have we been doing to try to keep this from spreading and creating new variants? So of course, getting vaccinated. That's always the number one thing. So now the vaccinations are approved for 6 months and older, pretty much like any other standard vaccine that's available. So the babies all the way up to the geriatric population. So everyone pretty much can get the COVID vaccine. So you would get your primary series. So that's the first and second dose, which are typically about a month apart. For the Moderna, anyway, it is 28 days. And then for the Pfizer, it's 21. So, getting those first two. And then initially last year, whenever I talked to you guys, the monovalent, which meaning that it covers, one of the variants of the vaccine. And at that point, it was the Delta. So as of, I think, late August of last year, the CDC came out with the bivalent booster. And that meaning that it covers, the different variants that are currently out. So you'll have coverage pretty much over whatever is out there now. But this is an ongoing process. Like, I'm pretty sure that soon enough they're going to have you'll be eligible to get a second bivalent or trivalent at that point booster vaccine.
I have a quick question.
Mm-hmm.
If you haven't had all the vaccines, do you have to go back and get all of them to get caught up, or can you start with the vaccine for the new variant?
So you would still have to get the primary series, which I'm pretty sure is still currently monovalent, and then the booster that you would get 2 months after your primary series, so after your first and second dose, you would get the bivalent booster, which would cover then these newer variants. But the CDC still wants you to be, I guess, in line with getting the first and second dose.
Very good.
The bivalent.
Mm-hmm. Very good. Okay, I'm sorry, I didn't mean to interrupt.
Oh no, you're fine. And then I did want to mention, so I know the question is probably coming up about like how, like people are still hesitant about getting these vaccines because they want to know if it's effective or not. And the CDC, has made that known that it is still unknown about how effective, especially these bivalent boosters are, since, like I said, they came out around late August of last year. So we're going on around 4 months now of it being out. So they have been doing some studies, and I did see some preliminary data that I saw online today. And it said, I have down that early data shows that the vaccine is about, or the bivalent boosters, I want to say that, is about 48% effective against asymptomatic infection in adults up to age 49. And then it goes to 40% effectiveness in adults 50 to 64 and 43% effective in people 65 plus. And I know there's like questions about how that variation comes about, but there's different factors that play into it, whether it's like, whether the 65-year-olds are in, assisted living facilities where they're in close contact, you would be more likely to catch someone if you're just always in that same kind of network of people. If one person catches it, then it's likely to spread on to the others. Because there was a nursing home recently I saw where they weren't accepting any visitors because of the outbreak again. So, and just with us being in the midst of winter now, we just have to take these precautionary measures for RSV, COVID, flu, pneumonia. Like there's other things out there that we tend to forget now that everything's so heavily talked about as COVID related.
And I would think people would wear a mask, and because the flu kills too.
Mm-hmm.
And it was noted that because people were wearing a mask because of COVID, the flu rates went down. So we would wear a mask just to keep people safe. Yes, COVID is very important to be safe from, but it's been proven that it's protecting us from the common cold and from the flu. So why not wear a mask?
Right. And it's so lax now, like in the workplaces, in schools as well. But I have seen some talk about it possibly being a mask mandate again, which, I mean, by any means, if it's going to help, keep some of these numbers down, keep people out the hospital and stuff like that, I'm all for it, because I want everyone to stay protected. And again, with the bivalent boosters, I did want to mention that the preliminary data says that the boosters will protect you for at least 3 months after you've received it. And, my personal opinion is that's what they can say now because we only have 4 months since it's been released. So, it has to be ongoing research that happens to see how it's going to hold up 6 months from now, a year from now, and that all determines of, if they have to revamp or tweak the booster again. So that way, I mean, I know initially they didn't want us to have so many boosters because, the flu shot is annually. But now with the boosters, there's been like 3 different formulations in the past year, and people, been getting them. So it's not up to par of where we want it to be, where it's just a once a year type vaccine yet.
Yes, understood. It's a good question. I don't know if you can answer it, but let's see what we can do. From Miss Ebony. Thank you, Ebony. I've gotten 3 COVID shots and they say that we will continue to need more. What advice can you give people who are tired of being vaccinated?
I understand. It's like I don't even know what to do because I mean the CDC is like the head all be all of, guiding us on these boosters and vaccinations and everything else related to public health. And it's like I don't want to encourage someone to like wait, until a final formulation is out. But, each time there's a newer formulation out, they do want to encourage you to get it within the appropriate time frame after your most recent one, to just try to, help prevent, transmitting it to yourself or someone else. So I don't really have any advice on those who are getting tired of being vaccinated. I just say, hold on, keep praying that we finally, get one that kind of just it's the end all be all of it. But we just have to recommend staying up to date at each time one comes out.
Yeah, and I think if we wear a mask and social distances, wash our hands, the things that we can do, this help us just lower the rate of COVID and eventually stop it. And unfortunately, it became politicized. And I know you can't say that, and get into that, but it has been. And, people they just politicize wearing a mask, getting the vaccination. And it's actually a tragedy because we've been getting flu shots, for decades. If you're in the military, whether you're active military or a family member, you get vaccinations to go overseas. And I am a military brat, and I remember getting full series of vaccinations to go overseas. It's for our protection. It's for our safety. And unfortunately, it's been politicized. And because it was politicized, it has drawn this out. It has drawn this out. And at some point, we're just going to have to just maybe think of others and say, I'm going to get vaccinated. Maybe not for me, but for those who have weaker immune systems for me. And that's about being a good citizen too. So I just said my little piece. Let's go ahead. I know you can't say that, but I'm going to say it.
Yeah, I definitely appreciate it. Definitely. And like you've mentioned, like the other precautionary measures, like you said, frequent hand washing. So just making sure, you're always washing your hands, especially after touching surfaces that, people that aren't in your same household, or even in your same household if you don't know where they've been out in, outside, before you're like touching food. Try not to touch your mouth, nose and stuff, eyes, because you just never know. Not even just COVID, just germs, period, are everywhere. Wearing the mask, and then, staying the 6 feet, trying to do outdoor activities more so than indoor. I know it's cold now, but still that gives you, more free air to breathe in. Like you said, exercising, getting some of that crisp morning air can help with breathing too. So there's also just added benefits. And then whenever you do feel sick, even if you don't think it's COVID, trying to stay at home if possible, until you figure out, exactly what it is. And like I said, with so much going on now, like just because you take a COVID test and it's negative, don't automatically assume like it's just a cold, because it could be flu, could be RSV. But all of that stuff is transmissible. RSV has definitely been hitting the younger children heavily within the past year. So, just trying to protect everybody, like Marilyn said. And so again, since we're talking about COVID, encouraging the flu vaccine as well. I know typically that's around 40 to 60% effective each year, but still, taking that shot at not trying to get it is also beneficial. So just making sure to stay up to date on all of your vaccinations.
Yeah, everything helps. Everything helps, folks. This is why it's public health, because we're helping each other stay healthy. So I see shingles vaccine. I have no idea about what's going on with the shingles vaccine. What's going on with that?
Yeah, so it was like my segue because as of January 1st, ACIP, which is like the guiding body over immunizations, which I guess kind of reports to the CDC, now have decided that all, I guess, ACIP vaccinations will be covered, which is including the shingles for Medicare population. So the shingles vaccine, there was an older one called Zostavax that was in like 2017 or so, and then that was a 1-dose vaccine for shingles prevention. Then afterwards, there was a newer formulation called Shingrix that came out, which is 2 doses, and it helps prevent shingles. So shingles, just as a recap, is basically reactivation of chicken pox in adulthood. I would say adulthood, but I guess like teenagers can get it too. But it's just basically reactivation of chickenpox. So whenever you have chickenpox, it obviously is a virus. It goes away, but it lays dormant in the nerves. So, at some point, if you come around, like as an adult, come around someone unknowingly with chickenpox, it could reactivate that in your body and it could produce shingles. Chickenpox is kind of widespread over the body, but the shingles typically leaves a rash on the trunk of the body, so like on the side. And I've heard it's very, very painful. Like even a bed sheet just laying on you can cause pain, and it's like blistering basically. So the shingles vaccine, as mentioned, it can be obtained from your doctors or pharmacy. No prescription is required if you go to the pharmacy. It's 2 doses, so you would get one whenever you first go in, and then 2 to 6 months later, you can go in to get the second dose. And so it's an intramuscular vaccine, just like the COVID vaccine. So, get it up here in your arms. And, as typical side effects are just soreness, something that you can work out, by just working the arm, rotating it, and things like that. And I highlighted the shingles vaccine because I do annual wellness visits with our Medicare population. And every time I recommend, trying to make sure they're up to date on flu shot, pneumonia shots, Tdap, shingles.
Go ahead and get that shingles, right?
Right. Every time they say, "Oh, I went to the pharmacy and the pharmacy told me the shingles vaccine is $150. I can't afford that, so I'm not going to get it." And so I understand. I was like, I don't have $150 just to, give to whenever you have medications and groceries and everything else like that to tend to. So as of January 1st, not only the shingles, but all of the other vaccines, including travel vaccines, like you mentioned, are now covered for our Medicare beneficiaries with 0 copayment or cost sharing. So that is definitely huge for everyone, to still stay up to date.
That's really good. I mean, it really is. Quick question about shingles.
Mm-hmm.
Can you get chickenpox from shingles?
I don't think it works that way because it's more so for the chickenpox to reactivate in as shingles. So if you get shingles, you more than likely had chickenpox at some point in time.
Well, I've never had chickenpox.
Right.
In my lifetime, as a child, I never got chickenpox. So I
didn't either. So, and I've been told that if you receive the chickenpox vaccine, which is a live vaccine, it essentially live vaccine kind of puts the virus in your body. So there is a potential for re-exposure based on receiving the vaccine.
Okay.
If that makes sense.
That's fascinating.
Mm-hmm.
Yeah. Okay. Yeah. Cool. I'm sorry. Go ahead. Continue.
Oh no, you're fine. And so that was more so for the Medicare population. And I did see actually beginning October 1st of this year that they're planning on expanding that rule over to the Medicaid population. So they're trying to make it, for everyone that they can, get all of their vaccinations at no cost, which is what I think should be anyway. And so I just wanted to
Agreed.
provide that update on that. Any questions regarding vaccines?
Do we have any questions? I think we're good with that. I don't see any questions.
Okay.
Um,
And then the last thing that I just wanted to briefly mention was the cap on insulin costs. So recently there was a legislation passed about capping insulin costs at $35 a month, which is huge. And again, that's for the Medicare population. And they're doing it in waves. So I guess on July 1st, they're planning to expand that for patients who have the insulin pumps, because as of right now, this $35 per month cap only applies to patients who are using pens, the injection pens. So like the Lantus, Solastar pens, Levemir Flex pens, Trulicity. I'm just trying to rattle off some of them. Those different ones where, put the pen needles on and you inject that. So for those who use like a continuous insulin pump, that will become available starting July 1st. And again, this is something huge because, as mentioned, there's just so many people who are a part of the diabetic population that insulin is just so expensive. It's like you have to choose between buying your insulin or buying groceries, and that should never be two things that you have to choose between to stay healthy. So making it more affordable
that
to get your insulin to keep your blood sugars down,
choose
because
between. That's right.
right,
Mm-hmm.
because that can, once your blood sugars get out of control, that could lead to amputations if it get that bad, loss of vision. Like there's a ton of complications that can come from impaired glucose control. So I do applaud the legislation for, at least taking this step to help out our populations. But again, there's still, because this is applying to those Medicare, beneficiaries. So there's still, the populations that don't have insurance. And I do want to, highlight St. James because we do have our 340B program, which allows us to obtain, some of those high cost brand name medications at a reduced price. And we're able to pass on those savings to our patients. So we can also help, you, I guess, make your medications more affordable. And we work with Care Pharmacy in Georgetown. So anytime there's any medication needs, as long as you're a patient of ours, we can help try to, remedy those super high costs of medications and help you, live a better lifestyle.
And yeah, because St. James, it's really known for that, the holistic approach to healthcare, not only providing primary care doctors, but wellness too. So you don't get sick or help you with chronic illnesses and etc. And accept any income level. So if you don't have a primary care doctor, you check out St. James Health and Wellness. Yeah, so that's good information. It's good information and actually a wonderful move to cap those insulin costs. And I know it's limited the type, but it's still very helpful because you're right. People should not have to choose between prescription and keeping the lights on.
Right.
Mm-hmm, very good. So, do we have any questions out there to our viewing audience, listening audience? We've had some good questions. If we have any more while we have Dr. Newman with us, we will take those. So drop those in the comment section. If not, Dr. Newman, what else do we need to know as we wrap up today?
I know with the sticky weather, I always paying attention to the weather alerts on your phone too, because you just never know what's going to happen. So just being always aware of your surroundings, especially.
Very true. We were talking about that before we started the show because of the rain today, and it's been a little heavy today. You could tell. And then I believe the emergency South Carolina EMD emergency management did say, keep an eye on the weather today, and there were some, I believe, tornado watches. I think you said that earlier, Dr. Newman. So that's another way to stay healthy. Don't get caught in a tornado.
Exactly.
It's very. As a matter of fact, I saw a video last night. A mother and child were, I guess, they just picked up the child from school or something, because you could tell they were having that kind of conversation. And they pulled up to a stoplight, and the winds, and they got caught in the middle of a tornado.
Oh my goodness!
And the kid, you can hear this is being recorded, so the kid is freaking out, and the mom is just calm until she finally said, "Duck down." And the whole time you're watching this video, it must have been on TikTok or something. And I'm thinking, why is she not telling the kid not to duck down? Because I think we don't think about the fact tornadoes create torpedoes out of loose objects.
Mm-hmm, mm-hmm.
And those things will go through your windshield.
Right.
And you don't think about stuff like that at the moment. But that's why it's important to keep an eye on the weather, because it changes. That wind kicks up. You may not think about you may think, the wind is not going to harm me, but it's the stuff caught up in the wind.
Can shatter that glass, shatter the whole car, actually.
Thank you. The whole car could have been picked up. And the kid is like, it's funny afterwards, because obviously you were not harmed.
Right.
But to hear the kid like freaking out, screaming, and mom is like, oh, look, the wind is picking up. And,
oh, no.
And it's like literally they're in a tornado. So,
goodness. I'm so thankful they're okay.
I'm thankful too. I'm glad you mentioned that too, because that actually is a health situation. It does impact your health. So
and always stand prepared and have emergency kits, water, some kind of non-perishable food items too, because you just never know. Lights might be out. You need candles, flashlights, all of that on hand, just in case.
I thought about St. James Health and Wellness because I always keep my eye out for grants, because after Hurricane Ian, we realized in Georgetown, people need to be pre-prepared. And I know every year, South Carolina Emergency Management puts out, the hurricane update and information, but to actually put packs together with non-perishable items so that you have that in your home and be prepared. Folks really need help with that. It takes money to put those things together. So maybe one day St. James Health and Wellness and Gullah Geechee Chamber of Commerce can partner in a grant so that we can help our community members get the non-perishable items together. So when a hurricane does hit, you're somewhat ready for it. And other natural disasters, because we've been having more earthquakes in South Carolina.
Exactly. Very true. And I would definitely love to help out with that partnership. So just let me know if there's anything I can do.
Yeah, and put some informational sheets in it, but the non-perishable items like flashlights and stuff that only may need to be updated once a year, but at least you have that physical plastic bin together that maybe, just kind of give you peace of mind, if nothing else. So, let's keep an eye out for some grants.
Right.
See if we can partner with something like that. Yeah. Well, Dr. Newman, it's always been great to have you with us. Really appreciate you and your information. And this is stuff that we needed to know. We take it for granted, but we really did need to know this information. It's good to know that we could count on you and St. James Health and Wellness to keep us up to date.
Of course. Anytime. Thank you again for having me.
You're welcome. And we'll see you next time.
All right. See ya.
Thank you. And everyone, it's always a good way to start the year, isn't it? To get that good information from St. James Health and Wellness. And just, it's a good year. Good way to start the new year and just kick it off and get that information. We appreciate you joining us today at a gathering place, and we'll be here Sunday and to update you. And of course, once again, it's late in the month, but Happy New Year, and thank you for joining us this month. Enjoy the rest of your day. Good night.